hepatitis as a dangerous disease worse than HIV and its cure. Hepatitis, what does it mean? It means disease of the liver. Any problem with the liver is referred to as hepatitis. Several things can cause inflammation or disease of the liver. Example, alcohol. Taking much of alcohol can be a factor to why the liver is having disease. And some drugs also cause liver disease. There are about 5 or 6 viruses, and they call themselves types in nature. And you have type A, type B, type C, type D, and type E. All of these exist as virus. How do we contact this particular virus? How is it transmitted? Transmission of hepatitis has been found to be common among people generally. And I'll mention a few ways. Example, sharing of sharp objects, blades, taking injection from people that could not sterilize their equipment, or using the same needle for 2 people. Some of us that call malam to cut our nails, or those that cut belu. Apart from this, barbing salon, your clipper give you a cut, another person's had hepatitis. Or you are fortunate to carry someone that had injury and the person has bleeding and it touches you, and you also have a wound on your hand, you catch hepatitis. Sexual activity can give hepatitis. Apart from all of this, those that do tattoo, they end up having hepatitis. I'm fond of the Muslims that even go to Mecca to do tooth something, or you visit dental for anything dental, you can get hepatitis from there. Ladies that go for D&C, they end up having hepatitis. And that's why we're discussing this topic, that is one of the most dangerous diseases. In fact, it's worse than HIV. How do you get to know that you have this disease? It's a disease that comes with different signs and symptoms. And it comes phase 1 and phase 2. The reason why hepatitis is dangerous than HIV. When you caught HIV today, as we speak, within 6 months to 1 year, signs and symptoms will appear. And you can quickly start taking treatment and you can manage it. For hepatitis, it can stay in an individual for 5 years, 10 years, 15 years, without any sign and symptoms at all. But anytime it starts manifesting its symptoms, especially the phase 2, just means that the person has received a death warrant. That means the tendency of that person surviving is very low, or let's say 50-50. The fact that the rate of hepatitis now is higher than ever before. About 1.3 million people died per year on account of hepatitis all over the world. As of 2019, about 1.1 million people died in a year. But as we speak in 2022, about 1.3 people died for that year alone. And it's been found that this disease is common all over the world, but some countries have it more than others. Example, China, Russia, India, Pakistan, Bangladesh, Philippines, that's 6. They have a lot of this hepatitis disease. Beyond that, in Africa, Nigeria and Ethiopia, Africa alone accounts for 47% of this disease all over the world, and it's more common between the age of 30 to 54, male and female, and it's also found in children. About 12% of children also have hepatitis. So these are issues that brings about why WHO is calling for action, the need to work together and see how hepatitis can be eradicated by year 2030. But the rate at which it's increasing in Nigeria, it doesn't look like in 2030 hepatitis can be eradicated in Nigeria. So in case you do not know, what are you supposed to do? Signs and symptoms that will help you on time to know that you're having hepatitis. In the first phase of signs and symptoms, you have fever, and you are likely to mistake that for malaria. You have lost appetite. You are likely to mistake that for typhoid. You're having body pain. You're likely to mistake that also for malaria again. You have nausea and vomiting. You likely mistake that for malaria again, and you have dark color urine. Your urine is really concentrated. like a Lipton tea or maybe Coke, and you begin to worry, then you take more water, it gets clear, whereas you have hepatitis. These are early phase of hepatitis disease. You can go through these in and out for months and years, but when you get to the second phase of signs and symptoms, whereby the fever now become permanent, you take paracetamol, you take anti-malaria, it's not going. Your joint pain is not disappearing. And you now notice some things. One, you are beginning to lose weight. Two, your urine become more darkened. Three, your stool becomes more pale, and you're also looking pale. And the next thing, your eyes is yellow. At this point, you are weak and tired. Any short movement, you are very, very exhausted, extreme tiredness. When all of this have started happening to you, remember, you are almost at point of death. And this is why we are bringing this to your notice, that hepatitis B virus is the most common and the most dangerous. So because when we come to cure, you will see that hepatitis A and E can be cured without taking any medication, A and E. But B, C, D are very, very dangerous. B is most common in Africa. C is common in the Asian world. This B has been found to have a vaccine. So when we come to treatment, all you need to do as an individual, now you're hearing this particular episode, walk to your doctor that you want to do a checkup on hepatitis. Doing the test, basic test, is no more than 1,000 naira, or highest 5,000 naira. And after that, you get to now do, if it is negative, you go for vaccine, 3 doses vaccine that protects you for life from this disease. And if it's positive, your doctor will know what to do next by doing some other tests. Your viral load, how much is the virus in your body, the DNA panel, and some other tests will be done. Ultrasound scan can be done, liver biopsy can be done. All of these need to be done to confirm the level of the hepatitis in your body system. If this virus is numerous and significant enough, you head up towards a cure, and that's where you get the treatment. May I clear this misunderstanding? For those of you that have this disease and you are placed on that capsule, Livolin Forte. Livolin Forte is never a cure to hepatitis. I know you have been on it for over months and years, thinking that you are curing the disease. You are not curing anything. Livolin Forte is a kind of capsule that supports the liver cell. It doesn't do anything for the hepatitis. So you must understand this very carefully. And finally, let me tell you, how does this hepatitis destroy the liver? When it gets into your body through any means, either through sharp blade or sex or anyhow, it travels throughout your body. It will not stay in any organ except it get to the liver. When it gets to the liver, it has ability to replicate itself. That means producing more children in your liver. And as it produces more children in your liver, it takes rooms. They begin to take rooms and parlor in your liver, occupying your liver cells. With time, when they get very plenty inside the liver, now that's when you start having the first symptoms of the disease. So, and as they're increasing the liver, they're destroying the liver structure. So that's why it will affect the function of the liver. All the function of the liver will now begin to go down, and you begin to manifest those symptoms. So, if, however, you have confirmed is positive, go for necessary checkup. And if that is significant, your doctor places you on medication. My concern for you is that doing a checkup now to confirm you don't have it and take vaccine is cheaper. But if eventually you delay and confirm it is there and significant, the cost is expensive. You'll be treated for like months and years. Minimum is about 1.5 years treatment. And the drugs are quite very, very expensive. Do not wait until you have been confirmed to have a significant level of hepatitis B. Check yourself out now and get to know that you are free. You will live a normal life. No one can survive hepatitis in the later stage of life. It is those that take care of themselves that can live longer. Remember, best enjoyment is healthy living.